Assalamu alaikum and a warm welcome this evening to our esteemed members of the IMANA community. It's both an honor and a privilege to welcome you to yet another insightful session of the IMANA Education webinar series. This evening, we're joined by Dr. Uzma Sayed, who has kept us updated and informed throughout the COVID-19 pandemic via multiple webinars already. Dr. Sayed completed her residency in internal medicine at Winthrop University Hospital, followed by a fellowship in infectious diseases. Today, she is not only a full-time practicing physician and business owner, but also a dedicated educator. Her journey is rooted in the dreams of her immigrant parents, which led her to become a distinguished infectious disease specialist and a revered author. Her commitment extends beyond her practice as she actively engages within the community, advocating for healthcare accessibility and safety. It's with immense gratitude that we welcome Dr. Uzma to share her knowledge and insights with us tonight. And on behalf of IMANA, I extend our heartfelt thanks to each of you for joining us on this journey to learn and empower our decisions for a healthier and brighter future. Thank you, and Dr. Sayed, the floor is now yours.
All right, so today we're going to talk about the fall vaccinations. Obviously, it's already that time of year. It's hard to believe that we're in October already, but basically this is the time when we really want to be starting to think about our annual influenza vaccines. And this time around, we are fortunate enough to have 3 vaccines that can be given during the season, which is the COVID-19 vaccine, influenza, and RSV in certain scenarios for certain population. So just a quick update on what's happening nationally for us. I know we haven't really been keeping track of essentially the numbers. The reporting has been far less than what we were used to before, but just to give you an outlook, if you have not been in the hospital facilities and you're not aware of, the hospitalizations and what's been happening, we are kind of plateauing from, we had a little bit of an uptick in cases and hospitalizations. We are in a different scenario now where we're kind of in the background of a lot of immunity, very different from where we were the last couple of years. But that doesn't mean that, that COVID is completely gone. Unfortunately, we do tend to see ebbs and flows. There will be peaks and valleys with this, and that's kind of where we are right now. And with the upcoming fall and winter season, we really are anticipating that we are going to have, obviously a lot more cases of COVID and flu. And last year, we all went through the triple-demic COVID, flu, and RSV. And, the hospitals were pretty overwhelmed at that stage. And we're hoping that we won't have the same scenario this year, especially because we have an additional vaccine that can be offered to people who are most at risk. And hopefully we can get people out there and get vaccinated and really see some better outcomes this year. So globally, basically, we're just looking at the numbers. And again, these are really an underestimate of numbers because just for sheer lack of testing, lack of reporting, there's only about a handful of countries that are actually reporting cases, but we know that we've had millions of cases. There's about 96 countries who are reporting, and 37 are reporting on COVID deaths. And so this is a little bit different from when we started the pandemic, but we definitely know that the cases are far more than what's actually being reported. But this is just to give you an idea of just a short glimpse in time of what's happening in the last 28-day period and what's happening in the last, 7 days, where you have about 3,000 new cases that have been reported. But again, we have to just keep in mind that this is still underreporting. There's still far more cases out there that are just not being tested, that are not being diagnosed, that are not being treated, and that are in turn not being reported. We are seeing that there has been a steady decrease in the number of cases and the number of deaths most recently. And so that's good, but we are anticipating that this is going to change as we head into, the fall and winter seasons in the global north. So we definitely have to keep that in mind. And this is just, again, we're so used to looking at these maps from WHO, and you can look at the COVID activity that's, globally. And this is just to give you an idea of what's happening throughout the world. All right, now if we look really quickly at what's happening in the US and specifically looking at variants and what's circulating for us nationally, we know that we've been through so many different variants with the SARS-CoV-2. And most recently, we've just been dealing with subvariants of Omicron. And you can see here, you will hear about different variants in the news over time. And you can see for a long time in the earlier part of the summer, the XBB variant was really the predominant variant that was circulating, and that was the one that was causing most of the cases in the community. The monovalent vaccine is targeting this XBB variant. And over some time, towards the end of the summer, you can see that that's shifted a little bit, where that percentage of the XBB has gone down and EG5 has now gone up. Now you have to remember, we're still dealing with all these subvariants of Omicron. The good news is that all the preliminary data does show that the current monovalent vaccine, which is the updated booster, is offering protection against, these subvariants. So it's always a good idea to get vaccinated. And again, there's been a lot of chatter in the news about the BA 2.86 subvariant, and there's a lot of concern about, could this be, more transmissible? Could it be have higher mortality? Well, so far it does not look like that's the case at all. And we can see actually, in fact, that this is really responsible for a very minuscule percentage of cases. We're looking at like less than 1%. So it's really not anything that is worrisome at this time. So let's move on to vaccinations. Who is eligible to get vaccinated? At this point, for COVID-19, it's recommended that everyone over the age of 5 get at least one updated COVID-19 vaccine. And this is at least 2 months after getting your last dose. So that's the recommendation. And if we look at the breakdown of which vaccines are recommended, how many doses are recommended. So if you're looking at children ages 6 months to 4 years who are not vaccinated, they should get at least 2 or 3 doses of the updated COVID-19 vaccine based on which one they've received. So if you're looking at the Pfizer vaccine, if their first dose is the updated vaccine, now these are children who have not yet received a single dose of any COVID-19 vaccine. So they'll get their first dose of the Pfizer-BioNTech vaccine, and then about 3 to 8 weeks later, they'll get their second dose, and then the third dose will be at least 8 weeks after their second dose. When you're looking at the Moderna vaccine, you have the first dose of the updated vaccine, and then the second dose is about 4 to 8 weeks after the first dose. Now, for children who have received their prior COVID-19 vaccines, it's a little bit different. So you're looking at children aged 6 months to 4 years. If they've been vaccinated before September 12th, they should get 1 or 2 doses of the updated vaccine based on, again, which ones they've received. So we're looking at a previous dose of a COVID-19 vaccine, which was then followed by a second dose of the updated Pfizer vaccine, and then the third dose at least 8 weeks after that. And if you look at Moderna now, for children who have previously gotten the COVID-19 vaccine, you're looking at an updated vaccine dose at least 4 to 8 weeks after the last dose. And that's for Moderna. Again, we're talking about kids who have previously been immunized, unlike the prior slide, which was for kids who have never received a single dose of the vaccine. Now, there's also some recommendations for people who may want another option for the COVID-19 vaccine besides Pfizer and Moderna. Now, these are FDA-approved vaccines that have been around for a long time. Most recently, there was an EUA, emergency use authorization, for the Novavax vaccine, which is a protein vaccine. Now, the thing that's a little bit different for this is that this is only under EUA, and it's only for people who are 12 years and older. And this is only if you're unable to get the other 2 vaccines. And this is just a timeline for the primary series. You get the first dose, the second dose 3 to 8 weeks after the first dose. And booster is, really just limited situations only. So these are the limited situations for the boosters where you can get it if you're 18 years or older. So again, the booster for Novavax is not approved for anybody who's under the age of 18. And if you have not gotten any other COVID-19 booster, and it's, as I mentioned, not authorized for ages 12 to 17. So if we look quickly at the history of vaccinations and what we're looking at now, as I mentioned before, a lot of this data is not really being collected currently that we had before. We had really heavy vaccination campaigns and the data was being collected, but this is just showing us the total vaccination doses that have been distributed, the total vaccination doses that have been administered. And if you look at the breakdown here, at least one dose of vaccine has been delivered to, we're looking at by age group, population greater than the age of 5, by 85%. And then when you go to age greater than 65, that goes up to about 95%. But if we look at the number of people who have received their updated, we're now talking about people who have had their full vaccine series and have received an updated bivalent booster last year, and look at the percentage, how far that drops down for people, children over the age of 5, 18%, over the age of 18, 20%, and over the age of 65, it's only 43%. So these numbers are really, really low, unfortunately. So we're hoping that with the monovalent booster, we'll have more uptake than these numbers. Now, there's some talk about insurance coverage as well when it comes to vaccines. I know there's been a lot of discussion about vaccines not being covered by insurances. Well, the government is not, as you're aware, the government is not buying these vaccines anymore. Most insurance companies are covering these vaccines. It's been a little bit of a slow rollout with the vaccinations, with the stockpiling in pharmacies. It's not quite the same scenario that we were in a couple of years ago. And so there has been some delay. There have been, scarcity of appointments. At times you're hearing that there's, not enough vaccine supplies, but that is all getting better day by day. It was already predicted that by October, things would be better, and they're already starting to get better. So the best way to really go about this is by starting out by calling your insurance provider and to see exactly which facility is within your network, so that you don't necessarily get a surprise bill, because these vaccines should still be covered by your insurance. And for people who are uninsured, so now besides looking at which facilities in your network, then you can kind of see which is in your location, so that you can properly schedule your vaccine appointment at the right location. And then for people who are uninsured, there's still ability and availability of vaccines for free. For children, obviously, they're able to get it through the Vaccines for Children program, but for adults, you can get it through the Bridge Access program. So there's still plenty of ways of getting vaccinated. You just have to seek out the right channels and make sure that you do get vaccinated. So the vaccines are there, and they are available. And this Bridge Access program is going to be running till about December of 2024. So this will really help facilitate delivery of vaccines to local pharmacies, for example, CVS and Walgreens. So anyone who's eligible to get a vaccine should really be able to get that vaccine. Finally, I'll just talk quickly about the RSV vaccine. So the RSV vaccine, is something that is recommended for a certain subset of population. Just to give you an idea, RSV does cause significant amount of illness and hospitalization, especially in the extremes of age, the very, very young infants and the very older population. As I mentioned before, we did see a triple-demic last year, and we certainly hope that we do not see one this year. There's estimated 60,000 to 160,000 hospitalizations a year from RSV, and about 6,000 to 10,000 deaths annually due to RSV just in the adult population of ages 65 and older. There's 2 vaccines that are currently approved and a monoclonal antibody. So it's really important to know if you are eligible to go ahead and schedule your vaccine. Talk to your healthcare provider first and foremost about eligibility and if this vaccine is in fact appropriate for you. So it's at this time recommended for anyone who's 60 years of age and older, who has risk factors. So again, this is based on shared clinical decision making. So it's recommended that you do talk to your healthcare provider about the benefits of this vaccine for you. So it's an individual basis. For infants and young children, we have the monoclonal antibody, which is recommended for anybody who is younger than 8 months, born during or entering their first season of RSV. And for pregnant women, this vaccine is also approved to be given at 32 to 36 weeks. which will then provide some protection during the first 6 months of life of the infant. So that's where we are with the RSV vaccine. And here, this is just listing some of the risk factors that we have for RSV. Again, if you're extremes of age, if you have underlying lung disease such as COPD, asthma, cardiovascular disease, any kidney or liver disorders, diabetes, any immunocompromised conditions, advanced age we talked about. If you're residing in a long-term care facility, so anyone who's in nursing homes, assisted livings, people who may be residing with others, who may increase with underlying medical conditions that increases them at risk for severe disease. And then obviously neurologic and neuromuscular conditions as well. So these are just some of the risk factors, but really it's all about shared decision-making and really having that conversation with your provider about if this vaccine is appropriate for you or not, and when to really time this vaccine. So we know that, in summary, COVID-19 vaccines are basically available for anyone who's 6 months or older. Flu vaccines are available for anyone who's 6 months or older. And for the RSV vaccines, it's basically anyone who's over the age of 60 with underlying medical conditions, pregnant women, and then infants, especially those who are under the age of 8 months, who are being born or in that time frame, that age bracket during the RSV season. So that's really what we're looking at for these vaccines. And really quickly, I will just like to say that it's really important that we do think about these vaccinations and the timing of this, because traditionally before the pandemic, obviously we had seasonal variations of respiratory viruses, and that's why we would see upticks in influenza and RSV and these respiratory illnesses during these months. And that has shifted quite a bit during the pandemic because of all of our interventions, all of our lockdowns, stay at home, non-pharmacological interventions such as masking and social distancing. And then slowly over the last year or so, we've seen a shift again, in these respiratory viruses. So we are anticipating, just like last year, that we are going to have more surges of these respiratory illnesses. And it's because the timing of it is that, we are going into the fall and winter season where it is going to be cooler. It is the holiday time. People are traveling. They are gathering indoors much more frequently. And there is a lot more interaction with people, and these respiratory viruses are around. So we are anticipating that that is really when we are going to see more cases. So to best protect yourself in this time frame, it's really advisable to start thinking about planning your fall vaccination series now, and to start doing that at this time so that you're well protected by the time the holidays come around, by the time your travel plans come into play, so that you do have some immunity. And we know that these vaccines, specifically the COVID-19 vaccine, the short-term immunity is really well for protecting you against even mild to moderate illness in the first 4 or 5 months after vaccination. After time, obviously, we know that the protection against severe disease and hospitalization is still there, and some of the immunity from mild disease does wane. But at least in this time frame, when you are going to be traveling more and gathering more, you will have that protection and that immunity as well. So I will take a few questions if we have any.
Yes, we actually have 2 questions from the chat here. The first one is, what do you project to be concerns for the winter season? Do you think COVID will be more of an issue? Should people wear masks again?
So that's a great question. Obviously, in the past couple of years, things have been rather unpredictable. We are at a place where we are seeing, like I mentioned before, ebbs and flow. We are seeing these peaks and surges. This is something that is pretty much here to stay. We're not anticipating that COVID or SARS-CoV-2 is just going to disappear. With the evolution of this virus, we've seen how there's all these subvariants. So because of the seasonal changes, because of, frankly, just the social activities and the travel, we are anticipating that we will probably see more cases and we will probably see more hospitalizations. But with every passing year of this pandemic, we are seeing that it's nothing like the initial stages. We are definitely dealing with the baseline population that's already immunized, and most people immunized and infected at some point. So you have a hybrid immunity, and other people who just have immunity from prior infections and recent infections. So overall, we're in a different baseline to begin with, but all those people that are at risk, again, will end up being hospitalized if they don't protect themselves. So, again, we know that the immunity is short term. So we know that these vaccines are not lifelong. And that's why we are urging people to really get vaccinated in a timely fashion and get the updated vaccines, because you want to have the best protection. So these are going to protect you against, the most recent circulating variants and subvariants. So we're really hoping that this will help people stay healthier, help more people stay out of the hospital, and for people to be able to travel and be with their loved ones and stay healthy this season. We've seen throughout the pandemic how, these non-pharmacological interventions such as mask wearing really made a significant difference. And based on the quality of the mask, the fit of the mask, the type of mask that you're using, you had the protection increased, and that is something that we've seen time and time again. So again, we are not in a situation where we're going to necessarily go back to universal mask mandates or anything like that, because the population is very different. We are all for the most part, majority of the people have been exposed, have been infected, have been vaccinated. So we have a baseline population that's very different from when we first started. And now, not only do we have vaccines, we have treatments. So we're in a different scenario. We're able to intervene when people are infected and give them life-saving treatments and really make an impact and get people better. So for that reason, I don't think necessarily that it's going to be something that's going to come into place where it's going to be mandated, but it is definitely something that works. So if you find yourself in a situation where you have to travel in a crowded environment, whether it's airports, trains, wherever you may be in close proximity to people, you may not have been vaccinated yet, you have an important event coming up that you want to be healthy for, and you don't feel comfortable, and people are coughing and sneezing around you, I would say it does not hurt to wear a mask to protect yourself. And obviously, the first thing is always to get vaccinated. And if you've been exposed or if you're symptomatic, then definitely get tested and get treated as well. So those are the things that are going to help.
Another question here is, for those who continue to question the safety of COVID vaccines, what data has been learned since the vaccines came out that can suggest that it's safe or not?
So these COVID vaccines, have been proven to be safe and effective. Millions, billions of people have been vaccinated around the world. We have saved millions of lives because of these vaccines. Being on the front lines, I can tell you the tremendous mortality that I saw, and it just continued throughout the pandemic, even after the vaccines were made available, where people were just afraid because it was something new, or they were hearing misinformation or disinformation, or they were just hearing from people that were not reliable sources. And I still had patients that were coming into the hospital who were severely ill, who were in the ICU, patients who didn't make it because they just didn't get vaccinated because their neighbor or their friend or somebody told them not to get the vaccine because they had heard something, but they didn't validate that information to find out, is it authentic? Is it from a true, reliable source or not? Is it accurate? And these people, unfortunately, when they're in the hospital, when they're gasping for their last breaths, they're asking for the vaccine at that time, and it's too late. The vaccine is not going to help at that time. So we have come a long way. We have so much data on the safety and efficacy of these vaccines. And I think that, has been proven with all these years and billions of doses of vaccines that have been administered and millions of lives that have been saved.
Thank you. I actually have a question that's kind of related to the original first question I had asked. Is there any special precautions or recommendations for individuals who plan to travel during the flu season other than vaccinations and flu shots and wearing masks?
Yeah, I think those are the basics. I mean, at least that's a starting point. I would say definitely just overall health and well-being. Make sure you're up to date with your healthcare maintenance. So, have your regular routine physicals, your dental visits, up to date on all your other immunizations. And, especially when you're planning a trip, You want to make sure that you maximize your time where you're traveling to, maximize your time with friends and family and loved ones. And so you want to be healthy the whole time that you're there, and while you're traveling there and back. So those are some basic things, always make sure that you're up to date, make sure you have enough supply of your medications that you need. You don't want to run out of your supply, and make sure that you have travel health insurance, for emergencies. There's obviously access to healthcare in the entire world, but it varies a little bit when you're leaving your home environment and, the comfort of knowing your physicians, calling for help, having a prescription called in, getting evaluated quickly may be very different in a different country and a different city even. So I would say the most important things would be definitely being on top of your immunizations, being on top of your healthcare overall, not delaying anything. If you have any procedures, anything that needs to be done, even simple things as dental work, you really should not delay your healthcare in any which way. You should be on top of that so that you make sure that you're just like, you're packed for a trip and you make sure you're prepared for your trip. You should focus on your health as well. So make sure you're up to date with all your vaccinations, COVID and flu and all your other vaccinations that you might need, especially if you're traveling to other areas where sometimes people need hepatitis vaccines, they need typhoid vaccines, Tdap boosters, all these things. So always speak to your provider to make sure that you have all the vaccinations. You may need malaria prophylaxis. You may need different things based on where you're traveling to. So it's always a good idea to check in with your healthcare provider a minimum of 2 weeks before your travel, minimum, but I would give yourself a little bit more time if you can.
For those who may be hesitant about getting a flu shot, can you share just some basic information on safety and side effects that they can expect?
Yeah, absolutely. So, this is something that I come across pretty regularly, well before the COVID-19 pandemic. There's a lot of hesitancy out there towards the influenza vaccine. And unfortunately, this misinformation has been spreading for a long time, well before the COVID-19 pandemic. So people hear things and they assume that, it's not a safe vaccine or, there are too many side effects. And none of that is actually true. The vaccine is very safe, pretty effective based on the year. We're hoping that this year also, based on what we're seeing on the Southern Hemisphere, that it will offer some protection. We also have to remember that even if you get influenza after getting vaccinated, the goal of the vaccine is not to prevent 100% infection, but it's to make it, if you do acquire the infection, that it's much milder, that you won't need to get hospitalized, that you won't be that sick. But the main thing that I hear a lot of times from people is that, I'm not getting the flu shot because I got flu right after I got the flu shot. Well, the vaccine does not give you influenza. It's not a live virus vaccine. So you can't acquire the virus from it. It's just the timing of the vaccine. When people start getting vaccinated, it's usually well into flu season. There's a lot of respiratory viruses around. People tend to wait till November, December, January, even when there's a lot of flu around and they're hearing about it. And so they go to get vaccinated. But it's just coincidental that they've already been exposed to a respiratory virus or influenza itself. And they do get sick around the timing of their flu vaccine. So it's not that the vaccine is actually giving them the flu. So that's one misinformation that has been spread for a long, long time. And people just need to be aware that the vaccine does not give you the actual illness. As far as side effects, it's pretty well tolerated. The basic common side effects of any vaccine: a little bit of soreness at the injection site. You might have a low-grade temperature, might feel a little achy, but nothing else really alarming. Most people do really well with this vaccine, and a day or two of a little bit of achiness, feeling run down, a little arm soreness, and that's about it. And then people feel well after.
So a follow-up to that question, what about for those who have adverse reactions to vaccines, whether it be flu vaccines or the COVID vaccine? What kind of precautions can they take, or alternatives that they may be able to consider?
So it really depends on what the adverse reaction is. Again, something that you have to discuss with your healthcare provider. Sometimes you have, adverse reactions that are not necessarily allergic reactions, that are not necessarily limiting from, that limit you from getting the vaccine. And other times it's more serious reactions where it's recommended that you don't get this vaccine. So obviously, if you have allergy to any component of any vaccine, you cannot get that vaccine again, right? So it's a contraindication. But sometimes people, they feel like after the COVID-19 vaccine, we know it's a reactogenic vaccine. We know that for 48 hours, you're going to have body aches, chills, you're going to feel miserable, that flu-like syndrome. And it's basically, the immune response. But that's, not necessarily something bad. That's not you having a bad reaction to the vaccine. That we expect that. And we know that it's short-lived, that after 48 hours, you get better, roughly about 48 hours, people feel better. And you can do things to help you through that. You can hydrate really well, you can rest, and you can take, any type of anti-inflammatories if you really need to, any Tylenol, acetaminophen, ibuprofen, anything like that. So those are the things that you can do if your arm is sore, things like that. But if you have a serious allergic reaction to any component of the vaccine, then you really cannot get that vaccine. And then you have to look for alternatives, whether it be an alternative vaccine. Like, for instance, we have this Novavax protein vaccine, which is now under EUA. So for somebody who absolutely cannot get any of the other COVID-19 vaccines, the mRNA vaccines, they may be a candidate for that. As far as other interventions that you can do, when you know that you're in the thick of respiratory viral season and there's tons of viruses around you, and you are going to be at risk based on your scenario, because you're not just sheltering at home, in lockdown anymore, you're around people, you can make sure that you're masking, you can make sure that you're washing your hands properly, that you're keeping somewhat of a distance. And if you notice that anybody's coughing or sneezing around you, that you are maintaining that little bit of distance, but just use these precautions to protect yourself. If you are gathering somewhere, you can find out, make sure everybody is, well. And again, it's all based on your medical history. So if you're immunocompromised, if you have risk factors, and you can't get vaccinated, then you definitely need to take extra precautions to make sure that you're safe. So if you do catch either influenza or COVID and you have high risk, obviously first test yourself when you're symptomatic, and then make sure that you get treated, because we have treatments for both viruses, and there's no reason not to get treated to make sure that you have better outcome and you feel better quicker.
One more question regarding COVID and flu vaccines in the chat here. I have some patients that are worried about getting both COVID and flu vaccines. Do you recommend people get both? Is it okay to get them at the same time?
That's a great question. So this is a question that's asked very frequently. Traditionally, influenza vaccines and COVID-19 vaccines recently have been given simultaneously. They've been given with other vaccines, especially during the initial stages of the pandemic, when the vaccines were getting rolled out and when there was this urgency, and when we wanted to make sure that there was equitable access to vaccines. There was no real safety data that showed any alarms for not being able to get the vaccine simultaneously, and there still aren't. And so it's still recommended that if you want to get both vaccines at the same time, you can. But what I always say is, because some people may be more sensitive, some people, because of some of these common side effects that happen after any vaccine, soreness of the arm, a little achiness, it may prevent them from getting future vaccines. That, I always say that if you have the luxury of time, if you have transportation, if you're able to schedule it, then you can easily space them out. The things that happen rarely are still going to be extremely rare. But for the most part, these vaccines are really well tolerated and co-administered. So it's really not a problem. But if you have the luxury of time and transportation and scheduling and everything like that, then go ahead and you can schedule them. It doesn't have to be at the same visit. You can space it out. You can schedule it according to your work schedule, and, do it when it's a weekend and you're not having to work. Just if you want to make sure that you're not feeling run down from one vaccine and adding a second vaccine to feel, achiness from that. Some people prefer to just, have it at the same time and be done with it so that they don't have to worry about it. But it's really a personal preference. There's really no safety data that says that you can't get it at the same time. There was really a push to make sure people get vaccinated at the same time, because there was such an urgency with the stage of the pandemic that we were on, where we had to save more lives and get people vaccinated as quickly as possible. But we're in a different stage right now. So if you can and you want to, you can absolutely space it out. But if you want to take it simultaneously, it's not anything that really shows any red flags, as long as you're feeling well and you have no contraindication to getting vaccinated.
And just one last question before we conclude for tonight. What are the key takeaways and precautions from this whole discussion that you'd like our viewers to keep in mind during the coming months?
I think the main thing is for people to really be in charge of their own health and their well-being. The pandemic has really shown us how fragile life is, how fragile we are, and how our time here is limited, right? And so we really have to make ourselves a priority. So make sure that you are taking charge of your health, making sure that you are making those appointments, because we get so caught up in our lives and we don't have time to take care of ourselves. We focus on everyone else. As caregivers, we focus on our family members. As physicians, we focus on our patients. We worry about everyone else but ourselves. We put ourselves last. So make sure you take that time and the opportunity to put yourself first. Make all your healthcare appointments, make all your vaccination appointments. And especially if you are high risk, I would say that the most important thing is to really protect yourself. And if you are over the age of 65, if you have any chronic lung conditions, COPD, asthma, if you're pregnant, these puts you in a higher risk category, and you really should focus on getting vaccinated sooner than later to protect yourself.
All right. With that, Dr. Uzma, thank you so much for sharing your expertise with us tonight. We'll conclude this webinar. For our audience, this webinar will be shared on our IMANA website and YouTube channel within the next few days. If you'd like to reference or share information with others, Dr. Uzma, thank you again, and we hope to see our viewers in our next webinar. So keep an eye out on our social media for that. We hope you have a wonderful rest of your evening. Assalamu alaikum and good night, everyone.